Thanks for joining me tonight. This particular presentation is called Physical and Behavioral Problems Often Seen in Autism, Troubleshooting These Issues, and then Suggestions for Intervention. This is a presentation that I have done in the past. Matter of fact, many of the presentations that I've done over the past year are actually available as movie files, and you can also access the color slides to each of these presentations at this particular website, Autism Seminars on Demand. So this particular presentation is actually available through that website if you'd like a copy of the slides or like to get a more high quality movie recording of this particular presentation. Before we get started, let me just give you some tips here on some educational material that I've used in my practice and I want you to know about. 2 books. These are excellent resource books for you to have in your library. The one on the left, Effective Biomedical Treatments from Dr. Pangborn and Baker. This is not a book that you would read from cover to cover, but an excellent book to look at with respects to questions about supplements, issues related to behavior, testing, some of the biochemistry with respects to biomedical intervention. And then the book by Dr. Shaw, The Biological Treatments for Autism and PDD. This is one of the first books that I read many, many years ago. This is a newer version. Both can be, accessed through Amazon. You can get the Biological Treatments book from Dr. Shaw through Great Plains' website. 2 really good books to have in your library. I also have a number of online resources. Autism Recovery Treatment is a blog site, a video blog site where I record video, transcribe those videos into articles, and then placed here on this site. This is all free information. And then I also have a very interactive parent subscription website where you as a parent or a caregiver of an individual with autism can really reach me 24/7 through this website through an interactive parent forum. Doesn't matter where you are in the United States. I work with people, and answer questions for people around the world. And it's a great place just from the standpoint if you have questions, want to troubleshoot, things, ideas on testing, questions you may have with respects to different therapies. That's what this particular site is for. I also have many of the recorded webinars on this site too, as well as the PDF files that can be downloaded of each individual presentation and the color slides for future reference. I also recently released a book called Autism Recovery Book.com. The title is Autism, The Road to Recovery. It's an ebook that you can access if you want to learn more about things that I've discussed, things that I discussed through this presentation, things that can be found through this book at autismrecoverybook.com. And as I mentioned before, the Autism Seminars on Demand.com is where many of these presentations were re-recorded in a movie file that is downloadable, as well as the PDF slides. And then finally, if you want to just get more information about me, you can go to drwoeller.com. This is sort of my official website. It's the hub of the wheel, if you will, that has links to many of the other different websites that I have online. Okay, so let's go ahead and get started here. What we're going to talk about is common issues seen with kids on the spectrum. We're going to troubleshoot some of these problems. I'll come up with some treatment suggestions that can help overcome some of the behavioral and physical issues. It's always important, no matter what information you get online, whether it's from me, another doctor, etc., is to discuss some of these supplement recommendations, some of the medication therapies that come forth with your own child's physician, really before trying to implement some of the stuff on your own. So we're going to go through a number of things. We'll talk about abdominal bloating, aggression, anxiety, diarrhea. Looks like there's some typos on this that I missed. Irritability, tantrums, regression issues, sleep issues. And if you've heard this presentation before, I'm really going to just sort of talk about these things in general, but then also give specific things that I've seen in my practice, some things that I want you to think about. Instead of trying to read each individual slide to you, that gets pretty boring. I really just want to have a discussion with you, things that I've experienced in my practice clinically over the years. So I want you to walk away from this presentation with some things in your back pocket that you can think about with respects to your child. When you talk about abdominal bloating, there are a number of things to consider. And the first thing that I think about clinically in my practice when I have a child come in who is just distended within the abdominal area, first thing I think of is gas. And we know that yeast and bacteria can produce gas, specifically yeast. And we know that yeast in bread is what causes that expansion. So one of the differential diagnoses for distended abdomen would be an overgrowth of yeast. Constipation can also be a problem in that backup of stool in the lower bowel can cause the bowel to become swollen, and that also can lead to a distended abdomen too. Also, constipation can become a breeding ground for yeast. So many kids who actually are constipated will oftentimes have an overgrowth of yeast and bacteria as well. Sometimes it gets to the point where it's so significant you need to have some diagnostics done to take a look from an abdominal x-ray to see actually how much stool is actually down in the digestive system. So distended abdomen, certainly constipation, yeast, and bacteria. Some kids actually have a deficiency or the inability to make adequate amount of digestive enzymes. There's not a specific test that we have for this that is 100% definitive. You can do a comprehensive digestive stool analysis. Great Plains has a CDSA test that actually looks at elastase levels, which is a reflection of pancreas enzyme output. But many times just doing a trial of digestive enzymes can be helpful. Peptizide and Zyme Prime are two enzymes that I've used quite a bit in my practice. Peptizide is really more specific for the gluten and the casein. Zyme Prime is a more all-around digestive enzyme for protein, fats, and carbohydrates. These are both from Houston Enzymes. They come in a capsule as well as chewable. Generally, one capsule is equivalent to about 2 to 3 chewable taken with meals or large snacks. Some kids have a hydrochloric acid deficiency, difficult to test for. And using hydrochloric acid supplementation, you have to be cautious, particularly with little kids who can't swallow a tablet or a capsule. You don't want them chewing a hydrochloric acid capsule or tablet because it can damage their teeth. So it's not something that I've used all that commonly in my practice. Another thing to consider with respects to persistent abdominal distension is just chronic inflammation. You may be dealing with a situation where your child has some type of inflammatory bowel problem. A lack of intestinal motility is present in some kids. It generally can be picked up through endoscopy or colonoscopy, where they can look at the surface lining of the gut. Sometimes doing further diagnostic testing to look for intestinal motility problems is needed to be done. It's not commonly done with kids on the spectrum just because it tends to be more invasive. But a lack of intestinal motility can manifest with some kids as constipation. So when we're talking about constipation, ideally we should all be having a bowel movement for every meal we eat. The reality is that doesn't happen. So even in most adults, if kids are having 2 bowel movements a day, that's great. Many times I'll just take 1 bowel movement a day. The reality is that we need to get the stool out. If we have any hint of constipation, the constipation is only going to become a problem with respect to an overgrowth of yeast and bacteria and the bowel toxins that come from that. So getting the stool out is of critical importance. One of the things that I've seen over the years is that many times constipation can lead to aggressive behavior, can lead to irritability, can lead to moodiness. For one aspect of it is constipation is uncomfortable. It causes pressure and sometimes pain. And then again, if we have any sort of concern with respects to yeast or bacteria, the constipation is just going to make things worse. The ideal thing with respects to stools is that the stools should pass easily. They shouldn't come out as a hard log, and they shouldn't be real loose, but soft in consistency and passed without much effort is ideal. Various constipating foods, breads, pasta, pizza, potatoes, cornstarch, bananas, these will all increase constipation for many children. A couple other things to think about with respects to constipation or persistent constipation. Again, yeast and bacteria can cause constipation. They can cause diarrhea too, but they can also cause constipation. Parasites as well. Specifically worms, pinworms, roundworms come to mind. You're going to be hard-pressed to do a stool test and actually find a worm. They don't show up very often on stool testing. But there are some hints that worms may be present. One of them would be chronic constipation. Another, a child who's constantly itching their bottom. Another is coughing in the morning. Morning coughing or clearing of the throat can be indicative of worms. One of the telltale signs, or at least one of the suspicious symptoms that seems to occur with worms, is a worsening of behavior during the full moon. So this has been known about now for many, many years, and as a big suspicion for worm infections, not only with kids on the spectrum, but a lot of individuals, but certainly with kids on the spectrum. If there's a clear, consistent pattern of a worsening of their behavior during the full moon, it's pretty suggestive that there may be an underlying worm problem. A couple different remedies. Vermox, which is also called mebendazole, is a prescription medication that has been used for pinworms and roundworms. 100 milligram chewable tablet given twice daily for 3 days. Usually what I do is I'll give a Vermox for 3 days, wait 2 weeks, and then repeat that dose. It's generally easy to take. They're chewable, and I don't see really any problems with them. New Beginnings carries some anti-parasitic herbs. Black walnut extract, for example, comes to mind. Half to 1 dropperful, 2 to 3 times daily, for a couple weeks is not a bad option. Usually, though, if I suspect pinworms or roundworms, I'm going to be looking to use something like Vermox, because the reality is that it tends to work so well. A couple other things to consider with respects to constipation and remedies for it. High-dose vitamin C is an option. Matter of fact, this has been a long-time naturopathic remedy in using ascorbic acid as a powder to what's called bowel tolerance, where you just give ever-increasing amounts of vitamin C because you reach a certain point and it has a laxative effect. It's not dose-dependent based on age or weight. It's dose-dependent on what you need to get the job done. It could be 1,000 milligrams, it could be 2, it could be 10, it could be 20. I had one child that needed 20,000 milligrams of vitamin C in a 24-hour period of time to finally open the floodgates, if you will, with respects to a persistent constipation problem. Probiotics have an added benefit. Not only do they add to the intestinal flora of beneficial bacteria in the gut, but if you use a lot of them, they can actually cause loose stools. So high-dose probiotics can actually have a laxative effect, which is beneficial for an individual with constipation. Again, it's not dose-dependent based on age or weight. It just is a natural reaction of the body to high-dose probiotics in some individuals. I always like magnesium, whether it's citrate or oxide, as a remedy for constipation. I use that quite a bit, 250 to 500 milligrams daily. I usually will give it at bedtime so that we can have, or at least attempt to have, a bowel movement in the morning, if possible. And then other things to try would be, aloe vera juice, fiber supplements like flax seeds, psyllium seeds, apple pectin. I can't say that any one of these works better than the others. Some of it has to do with consistency, some of it has to do with taste, some of it has to do with what mixes well in a pear sauce, applesauce, or a smoothie that your particular child will like. Another option actually is magnesium. You can do magnesium to bowel tolerance just like you can vitamin C to bowel tolerance. Usually don't have to use as much. So some kids do fine at 250, others at 500, some at 750 milligrams. I try not to use more than 1,000 milligrams of vitamin C, either in citrate or oxide, on a daily basis for kids. So if I was going to do a bowel tolerance remedy, magnesium versus ascorbic acid, I'd likely lean towards ascorbic acid, and then just try to use a regular dose of magnesium, 250 to 500 milligrams as some added benefit. The one thing that you might consider if you're going to consider something like ascorbic acid is if your child has some type of known oxalate problem. If there is an oxalate concern, well, then using real high dose vitamin C is probably not the best thing for them. So, other options can come into play. But the bottom line here is just try to, you got to get the poop out. And that also means, too, some kids need enemas. Some kids need suppositories to do it. True Fiber is a great product. I really like True Fiber since I started using it. It's a digestible fiber. It's also a prebiotic. Essentially, it's a fertilizer, if you will, for the good bacteria in the gut. 1 to 2 teaspoons or a tablespoon daily seems to work well for most kids, just as an added product to help with constipation. Keeping kids hydrated, as I mentioned before, sometimes you need to do laxatives, sometimes you need to do an enema, for 2 to 3 days to help unload the lower bowel is really important. One thing to keep in mind with respects to constipation, there are some kids who appear to be having a bowel movement every day. So they actually, maybe, produce a 3 to 4 to 5 inch piece of stool, and it looks like they're having a normal bowel movement, but they still remain really distended, their abdomen's hard, and appear swollen. But if you look at their tests, they may not have really high levels of yeast or bacteria. But if you were to do an x-ray, you'll often see in some of these kids a bowel that's overloaded with stool. So what's happening? Well, what they're doing is they're pinching off a small section of a larger piece of stool. So technically they're constipated, but they're actually producing a section of stool every day, but they're not completely evacuating the lower bowel. This is why when you're dealing with constipation, many times if you suspect that there's fecal plug, a large section of stool in the lower bowel, and usually you can tell because it comes out really hard and dry, which means it's been sitting there a while and the lower intestine has been absorbing the water. This is why in some cases it's actually better to do some type of a suppository one time daily for 24 hours or 48 hours or over a 3 to 4 day period of time to try to unplug the lower intestine, and then your other remedies, whether it's magnesium or vitamin C or aloe vera juice or whatever it may be, has a better chance of working throughout the gut. So it's sort of trying to unplug the drain before adding things to try to push stool through the digestive tract. So if you're still running into a problem of constipation despite the probiotics, despite the fiber, despite the magnesium, you're probably dealing with a situation where your child has a fecal plug way down in the lower bowel. Let's switch gears here and talk about diarrhea. What are some things to consider with respects to diarrhea? Well, certainly the number one thing on the list would be infections. Yeast can cause diarrhea. More commonly, bacteria and parasites will cause diarrhea. And there's a pattern that you need to pay attention to. Is the diarrhea continuous? Or I should say diarrhea and either loose stools too, okay? It doesn't necessarily have to be full-on diarrhea. It could just be loose stools. Is it continuous? Is it intermittent? Is it cyclical? Or does it alternate between diarrhea and constipation? Usually, diarrhea, loose stools, is an underlying sign of an infection, inflammation, and allergy. So, if it's continuous, think of either chronic inflammation, some type of inflammatory bowel problem, or a bacterial infection. If it's intermittent, which means it only happens once in a while, it's likely related to some type of food intolerance. If it's cyclical, okay, so maybe it occurs every 7 to 10 days or every 14 to 21 days, maybe it only hangs around for about 3 days and then the stools firm up and then it cycles back. Usually highly suspicious of a parasitic infection, whether that's Giardia, Cryptosporidium, Entamoeba histolytica, some type of parasite, okay? Alternating diarrhea and constipation, that gets a little more tricky. Certainly could be an infection. Chronic inflammation could also play a role. You could also be dealing with stool impaction. I had a case many years ago of a child who had severe constipation, but it appeared like he was having loose stools, because periodically you would have these loose stools emerge until an x-ray was done and actually found that he had a softball size fecal plug in the lower bowel. So what was happening was he was leaking stool around the fecal plug. And it wasn't until we got the fecal plug out that his bowels started to normalize. Some kids, unfortunately, have persistent ongoing bowel problems where they really need to be scoped. They need a diagnostic workup from a pediatric gastroenterologist, a specialist, to evaluate what the heck is going on. And this generally requires endoscopy to look down the esophagus into the stomach, as well as a colonoscopy to look at the large intestine, and in some kids doing what's called a pill cam evaluation, where a camera the size of a pill capsule is deposited into the upper intestine, and then it moves its way through the bowel. The child wears a belt that receives the images from the camera, and that helps to identify more insidious problems occurring in the small bowel. And that's something that Dr. Krigsman does. Krigsman is a pediatric gastroenterologist in Texas who is an expert at doing thorough GI evaluation, gastrointestinal evaluation for kids on the spectrum. So a couple things just to consider there with respects to diarrhea. Oh, by the way, let me just go back real quickly. When you're talking about parasitic infections, and this is not a specific talk on parasites, but two very common medications that have a cross ability of covering different parasites. One is Flagyl. Flagyl you've probably heard of with respects to Clostridia bacteria treatment. Another is called Alinea. Both are found at most most pharmacies. Alinea is still under patent. I do not believe it can be compounded. Flagyl can. Alinea is very specific for Giardia, very specific for Cryptosporidium. Flagyl is also very good for amoebic parasites, not so good for Cryptosporidium, does pretty well for Giardia, does a good job for bacteria such as Clostridia. Flagyl is going to be much cheaper, much more readily available, much more ability to get it covered through insurance. Alinea, not so much. It's not used as much, but Alinea is a very good antibiotic specifically for Giardia and Cryptosporidium, but it's more expensive. So a couple options. If this comes up for you, if you've got a test, you've got suspicion, you've got questions on these types of things, this is where you can actually reach me through my autismactionplan.com website, through the parent forum. You can post me these questions there, and I'll be happy to go through a lot more of this information with you in greater detail. Let's switch our gears to anxiety, another huge problem with kids on the spectrum. It's not an easy condition to treat. There are a number of natural remedies that may be helpful, and I say maybe because they're not universally helpful, unfortunately. And usually it's not just one remedy, sometimes it's a number of these things in combination. I can't give you a specific amount based on age or weight. Again, with these supplements, they're really dosed really on need. So you have to start somewhere and then adjust it as you go. GABA is a calming neurotransmitter in the brain. It has been helpful for some conditions with respects to anxiety. Anywhere between 500 to 5,000 milligrams. Usually in my practice, about 2,000 to 3,000 milligrams per day does a good job. Some kids need a higher amount. And again, it's not universally helpful, but it is a pretty darn good first start if you're looking for a supplement to help with anxiety. Theanine is an extract of green tea. Theanine at 100 milligrams to 400 milligrams per day works pretty well in association with GABA. Inositol powder is an interesting supplement. It comes at from New Beginnings, about 700 milligrams per dose. Comes as a powder. It's easy to mix in water, easy to mix in dilute juice. It actually has been studied with respects to obsessive compulsive disorder. It's been an effective treatment for anxiety in association with GABA. And I've also found it to be selectively helpful for some states with respects to obsessive compulsive behavior. Again, not universally, but it's something to consider. Magnesium has a role in anxiety. It doesn't work by itself as well as GABA, specifically for anxiety. 5-HTP has some usefulness too. 5-HTP is a supplement that actually is a precursor to serotonin. Again, not a specific dose based on age or weight. 1 to 2 capsules a couple times a day is not a bad place to start. You have to be cautious though, something to talk over with your physician. If your child is taking what's called an SSRI medication, a selective serotonin reuptake inhibitor, Prozac, Zoloft, Paxil, you need to be cautious with 5-HTP because you may just drive too much serotonin, which is not a good thing. A couple other things that I've actually had some good success with respects to anxiety, particularly social anxiety, generalized anxiety, is oxytocin. I actually have entire presentations that go into oxytocin much more in depth. The nasal spray is not a bad option. Most of the compounding pharmacies carry it. Hopewell, Park Pharmacy Wellness, Lee Silsby. The nasal spray works mostly pretty good for older kids. For smaller kids, they're not too happy with a nasal spray. This is where an oxytocin tablet is going to be a little bit more effective. Again, the dosing isn't based on age or weight so much as just a starting point. If I'm using a tablet, I'll generally start with a 5-unit tablet, and I'll give it a couple times a day. And then if I can do a nasal spray, I may use the nasal spray as not an emergency, but as a therapy I might use in limited circumstances because it has a pretty quick onset. Let's say a child has a problem going to the mall or going to a restaurant where they get real anxious. Many times using a nasal spray in the moment can help decrease anxiety very quickly. And it could be 1 to 2 sprays per nostril to get the job done. So oxytocin has been a nice addition to biomedical intervention, specifically with respects to generalized anxiety and social anxiety, because the social part is that oxytocin in the brain helps to increase the facial recognition, voice cue, emotional recognition with people. A couple other things that have been helpful for anxiety. One is Respen-A, which I'll talk about shortly, and then Namenda. Namenda is actually a medication that's been used for Alzheimer's patients, and it actually has been helpful for some cases with respects to anxiety. Respen-A is a remedy that's been around now for about 4 years. I've been using it in my practice, and it actually is a disc that's worn on the skin. In that disc is a very small amount of something called reserpine. Reserpine comes from the Indian herb Rowalthia. Long time ago, Rowalthia as a bulk herb was used for hypertension. There was a study back in the mid-50s that used a liquid or an herbal elixir, an oral suspension of high-dose reserpine in autism, and what they found was these kids had greatly improved socialization, language, environmental awareness, less sensory issues across the board. The problem was they had some side effects too. Some of the kids became irritable because of it. Some of them had what probably was from low blood calcium, where they got cramping and became agitated, because reserpine is actually known to decrease blood calcium levels. Not the Respen-A, but the oral elixir reserpine can do that. And so there's some special circumstances. Some of the kids over time became real emotional. Well, they likely became that because what was happening was the reserpine was upregulating a specific enzyme called MAOA, and MAOA is responsible for serotonin metabolism. And over time, if you're not replacing your stores of serotonin, you can start to run a deficit, and this can lead to irritability, moodiness, emotional instability. Let's fast forward and talk about Respen-A, because Respen-A is low-dose reserpine delivered through a disc. It's not a high-dose herbal oral elixir. And so the side effects, if they do occur, are much more stable and much more low-key. The benefits that have been observed with respect to Respen-A really fall into two major categories: improvement in socialization, where the kids are more engaged with the family, more willing to participate, more empathetic, they're happier, they many times just are overall improved in their mood. And then in some kids, they have more complex speech, more deliberate and specific speech. I haven't seen a situation where a child went from being completely nonverbal to speaking, but kids who at least had some language, some words, started to speak more. Side effects with respects to Respen-A: hyperness, very common with many different biomedical interventions, nothing that's too extreme. Some kids have become irritable. That's likely because of its influence on calcium. Moodiness, emotional and depressed. That's why when we use Respen-A, we make sure kids are getting enough protein or using supplements like 5-HTP or tryptophan for serotonin support. I had one child that had increased stimming because of Respen-A, but again, that's not real common. Overall, Respen-A has been a very favorable treatment. It's something that you have to study. It's something that you have to look into. It's not a treatment that doesn't require some input on your part. What I mean by that is it's not just about putting the disc on the skin and walking away. Putting the disc of Respen-A on your child's skin is easy, but you also have to take some supportive supplements with it. Calcium needs to be taken at a certain amount. We found out over time from the main researcher and innovator with respect to Respen-A, Elaine Delac, that many times we have to modify other supplements, modify the amount of essential fatty acids kids are getting, vitamin D, things like curcumin, all can have an inhibiting effect on the effectiveness of Respen-A, at least early on. Also, B6, magnesium, calcium, as I mentioned, and inositol are supportive supplements to Respen-A's effectiveness. So many times those have to be used too to help Respen-A work more optimally. So it takes a little bit of time to learn how to work with it, a little bit of tweaking, but overall it's been a very, very encouraging treatment and something that I've used quite a bit and continue to use in my practice. So if you want to learn more about Respen-A, you can go to their website, which is www.respen, that's RESPEN-A.com. I also have a section on Respen-A in my Autism Action Plan site as well. Okay, what about gluten infraction? What are some things to consider here? What are some things to watch out for? And this would also be for casein as well. A couple things to have on hand. If you know your child is extremely sensitive to gluten, extremely sensitive to casein, then I would make sure I'd have some Pepcid AC on hand. You can get this over the counter. This is only going to work, by the way, if you can catch the infraction right away. Anywhere between a quarter to a half a tablet, taken immediately after ingestion, will many times nullify the negative reactions from gluten or casein. Epsom salt cream, as well as Epsom salt baths, can be helpful. This is something that can be done even if you didn't catch it immediately. I wouldn't say days later, but if within a couple hours, putting Epsom salt cream on the skin, or doing an Epsom salt bath. I learned from a parent a long time ago, her child had an extreme sensitivity to gluten, and whenever the child had an infraction, she would put her child in a bathtub with about 3 to 4 inches of water, and she would supersaturate it with Epsom salt. Use about 4 to 5 cups, which is actually quite a bit in a small amount of water, and she'd have her child sit in it. And she swore by this, that it helped to nullify the negative reactions that her child would have to gluten. Some kids' skin is really sensitive. I mean, magnesium sulfate is a salt, so it can be a little bit itchy and a little bit irritating. So just be aware of that. Couple other things that are worthwhile. I've had parents who carry around a bottle of Peptizide. Peptizide is that Houston enzyme that is specific for gluten and casein digestion. Again, this has to be an immediate. This isn't something where they eat gluten and then 6 hours later you give them a Peptizide. It's not going to do anything. Some parents carry activated charcoal to help bind up the gluten and casein right away, immediately after exposure. Alka-Seltzer Gold can be used, kind of similar principle as the Pepcid AC. Essentially what you're trying to do is just neutralize the acids so that the peptides of the gluten and casein don't get broken down readily and then absorbed. So a couple options there. By the way, if you're going to do Alka-Seltzer Gold, it's got to be the gold. It can't just be regular Alka-Seltzer. So I think probably the easiest thing to do is carry around an extra bottle of the Peptizide enzymes. And if you know your child is really sensitive, the Pepcid AC is a good way to go. Okay, hand flapping. There's not one specific treatment for hand flapping, and I realize that hand flapping can be situational. Okay, it can just be a behavior that a child has because they're excited about something. Watching a video, watching a TV show, whatever it may be, something that's just a situational. But sometimes hand flapping has been associated with toxicity and sometimes dietary infractions. Ammonia is known to cause hand flapping. Ammonia for most kids on the spectrum is going to be generated by bacterial dysbiosis in the gut and protein maldigestion in the gut. It's not always some type of internal biochemical urea cycle problem. So a couple things to consider with respects to that. If you are suspicious that your child is hand flapping because primarily of bowel toxicity, it goes back to those bowel remedies. Activator charcoal to help bind up intestinal toxins once to twice a day. Whenever you do activated charcoal, be cautious because activated charcoal can be a constipating agent, so you need to work on things to prevent it. I usually, when I prescribe activated charcoal, will also prescribe magnesium. And again, I'll use 250 to 500 grams a day with activated charcoal use to try to prevent, as best I can, the constipation. Alpha ketogluteric acid is a supplement that you can get from New Beginnings. It has been helpful in reducing ammonia levels in the body, whether they're coming internally from protein maldigestion or bacterial dysbiosis. It's not universally helpful, unfortunately, but it is something to consider. Again, percentage-wise, for most kids, their ammonia issue is going to be gut-related in the vast majority of cases that I've seen. So again, look at constipation, protein digestion problems, even yeast overgrowth, digestive enzymes working on the gut. Hyperactivity, probably one of the more troublesome things to try to figure out and help, particularly from a supplement standpoint, can be extremely difficult and quite challenging. The first thing I think about with any kid who is hyperactive is diet. So some type of food sensitivity, whether it's to wheat, soy, dairy, a sugar intolerance, what's their diet like with respect to sugar consumption, juices, sodas. A biggie is artificial colors and flavors. This is one of the first things I try to do is talk to parents with respect to hyperactivity is really cleaning up their kids' diets. And the Feingold Institute, you can go to feingold.org, great website with regards to information with respects to food dyes and flavoring sensitivities that can trigger things like hyperactivity. And it also talks about the link between what are called salicylates and phenols. So if you have a hyperactive child, nothing else seems to be working, you're doing gluten casein free, you're doing supplements, you're trying to get them off of the Ritalin type medications, please, please, please look at artificial colorings and flavorings, the salicylates and the phenol connection through the Feingold Institute. A couple of the things that can lead to hyperactivity or exacerbate hyperactivity: a lack of nutrients. So lack of B vitamins, a lack of essential fatty acids. This is one reason that cod liver oil has been around for so long as part of a supplement in many of the introductory supplement programs for kids on the spectrum. Lack of antioxidants, yeast overgrowth. Some kids are hyper because of yeast. Not all the time. Not every kid with yeast is hyperactive, but think of it, okay? This is why I always recommend doing the organic acid test from Great Plains, because it gives you a good insight into yeast and bacterial toxins, other metabolic imbalances, but it really specifically helps to identify yeast, which is such a problem. Again, going back to a lack of nutrients, New Beginnings Nutritionals has something called a starter packet, which includes B vitamins, includes essential fatty acids through cod liver oil, includes antioxidants, a nice place to start. Some additional things that have been helpful for some kids' hyperactivity, I wish they were universally helpful, but not always. Folinic acid can be a helpful adjunctive supplement to kids' programs. Usually about 800 micrograms per day, not a bad place to start. Pycnogenol has had some usefulness in some cases. Pycnogenol is not one of the first things I think about when I think about hyperactivity. Taurine can be helpful in association with folinic acid. Again, there's not a specific amount based on age or weight, but it's been useful. Methyl B12 therapy, it's interesting. Some kids actually who are hyperactive do really well with methyl B12, even though one of the most common side effects of methyl B12 therapy, whether it's nasal, injection, oral, or the lollipop, is hyperactivity. But many times what you'll find is there can be a slight elevation of hyperactivity for a period of time, and then the hyperactivity can actually diminish, and then you start to see an emergence of eye contact and awareness and sometimes language. So methyl B12 therapy is an option. Epsom salt baths, Epsom salt cream, which we talked about earlier with respect to the gluten infractions, has been helpful too with respect to hyperactivity. And then of course looking at the phenol issue is really, really important. So I can't give you an exact protocol of, do all 10 of these supplements and this for every particular child, because it's very individualized. But what I really want you to get, come away with from this particular discussion about hyperactivity is looking at food, looking at the diet, specifically with respects to the phenols and the salicylates. Treatment-wise, and we could have an entire discussion here, about Ritalin-type medication. An interesting remedy which doesn't get a lot of play and doesn't get a lot of interest from parents and from doctors too is something called the nicotine patch. But I wanted to point it out to you just so you knew about it. The nicotine patch idea was proposed by Dr. Bradstreet a number of years ago. And what has been found with respects to understanding the biochemistry of nicotine is that its primary mode of activity is that it stimulates things called the nicotine receptors, which helps control the production of acetylcholine. Acetylcholine is a part of what's called our cholinergic nervous system. It modulates other chemicals in the brain, specifically with respects to attention, to memory, to the speed of mental processing, to just an overall improvement in cognitive function. And it's also been helpful at reducing hyperactivity in some kids. So let's look at it a little bit closer. What was being used and what has been used is purchasing a 7 milligram nicotine patch. And again, this is something that you've considered. This is something that I highly encourage people to talk over with their doctor about. But we're not using an entire 7 milligram patch. You're generally only using a quarter to a half of a 7 milligram patch. One patch is equivalent to 0.15 milligrams of nicotine being delivered per hour. A common cigarette provides anywhere between 2 to 3 milligrams of nicotine. So we're talking about very, very low amounts of nicotine applied through the skin over a 24-hour period of time. So it's a very low amount delivered in a continuous way to try to stimulate these nicotine receptors, and it's been helpful at reducing hyperactivity in some kids as well as focusing issues. Some kids get some sleep disturbance from it. If that's the case, the patch can be worn for less period of time, maybe 14 to 16 hours a day. So it's an interesting remedy that's been helpful for some kids with respects to hyperactivity. And again, it could be considered an alternative potentially to the common medications. Would this be the first thing I would reach for? Of course not. I would be looking at food sensitivities, yeast issues, nutritional imbalances, phenol, salicylate sensitivities. I'd go through that entire list first to see if we could get some inroads with respect to hyperactivity before I would even consider something like a nicotine patch. And I would encourage you to do the same thing. Irritability. We're also now falling into that group of the discussion with respects to aggression. A couple things I want you to be aware of in thinking about your child's mood. Is it continuous? or is it intermittent? Is it situational? Is it potentially, or is it age appropriate? Situational, what could be some situations that could generate behavioral problems? Is it only occurring at school? If it is occurring at school, when is it occurring? Is it occurring around lunchtime? Is it occurring after lunchtime? Maybe it's something to do with their food. Could be low blood sugar. Is there some new kid in class that's bugging them? Is it occurring with neighbors? Is it occurring with an aide? So one thing is not every problem is related to a medical issue. It could just be an environmental problem. Is it age appropriate? And this gets hard, honestly, because you can have a 6-year-old child on the spectrum who behaves more like a 4-year-old. So by age, they're older, but by developmental age, they're not. So unless you have another child in the family that you can reference things to, sometimes it's hard to know. But sometimes kids act out behaviorally because of their age, the old terrible 2 scenario. Sibling rivalry. Even though you may have a child on the spectrum, that doesn't mean that they're always going to get along with their brother and sister. So it doesn't mean necessarily that there's a medical problem. It could just be that their brother or sister's bugging them. I mean, I see it within my family with my daughter and my son. Sometimes they're going to fight. So that can happen. So again, this can be. Again, diet, okay? Artificial colors, flavors, these salicylates, these phenols found in chemicals. I could take this conversation back, with respects to that, to what we just talked about with respects to hyperactivity. The same thing. B vitamins, essential fatty acids, antioxidants, yeast overgrowth, but more commonly, irritability, moodiness, tantrums. If it's going to be tied to some kind of biotoxin, it's going to be tied more specifically to a bacteria. Worms may be an issue, particularly if you see it around the full moon. That's certainly a possibility, but more often than not, a moody, irritable, tantrumy type behavior is more bacterial based than it is yeast based. So therapies, you got to do some investigation, and we can start to look at things like testing, like the organic acid test, etc. A couple of the things, what I've tied into here with respects to irritability and tantrums would fall into the category of anxiety. So many kids who are anxious, when they're overly anxious, will become irritable and may tantrum, okay? They can't necessarily tell you, but that's what's going on. So this then references us back to what are some things that are useful for anxiety. The theanine, the GABA, the inositol. They may be helpful. Aggression. Again, hyperactivity, anxiety, irritability, agitation, moodiness. Now we have aggression. Same thing. Is it continuous? Is it intermittent? Is it situational? Is it happening at school? Is it happening with neighbors? Is it happening with an aide? It's not always a problem medical-wise. Quick story. Years ago I had a patient, and this is actually a case that I present in my Autism, the Road to Recovery book, was a boy, severely autistic, who did very well on dietary intervention, really, really bad behaviors. But what happened was there was a point in time in treating him where he started to develop a behavior where he would come home from school, and 2 hours or whatever it was after school, he would tantrum so much that he would essentially destroy his bedroom and just, and essentially go through the home and tip things over, throw things, and just was out of his mind. What we finally found out, and what came of this through the pattern, is that it was only occurring Monday through Friday. It wasn't happening on the weekends. Well, it turns out that what he was having low blood sugar. He was hypoglycemic. He wasn't eating his snack at school, and he only sporadically ate his lunch. So what was happening is when he came home from not having eaten his lunch and not having eaten his snack was he was hungry. He couldn't tell his mom he was hungry. He just lost it. And he would tantrum and tantrum until, finally at some point he ate something. Interesting is that it wasn't occurring on the weekends because he wasn't in school. It was remedied by making sure his teachers knew that he ate, that he had to eat something, he had to eat his food, and then also he needed to eat a little something before he headed home. And once that was the case, no more tantrums. Same thing here though, okay, from a biomedical standpoint. Diet. Think about diet. Is there some type of problem? Particularly the sensitivity to the phenols and the salicylates. Allergies. Is it a possible food allergy or environmental allergy? I've had kids who've left their home, they go on vacation, they do fine, they come back to their home and they start getting aggressive and irritable. Could be mold damage. Not real common, but it's something that does happen. The other thing you absolutely want to rule out and work on and remedy is constipation. I've seen more kids develop acute problems with aggression when they become constipated. So that whole discussion we had early on about constipation. One of the reasons I also recommend doing the organic acid test from Great Plains Laboratory is to rule out Clostridia bacteria. Clostridia bacteria, there's a bunch of these bacteria. They produce, some of them produce, a marker called HPHPA. HPHPA will affect dopamine. When dopamine becomes erratic, it causes erratic behavior. And this, I've seen this over and over and over again in my practice. Really, really important to assess and to consider. There's a wide variety of treatments for Clostridia problems, everything from Culturelle to Saccharomyces boulardii to the use of Flagyl to the use of vancomycin. They're very individualized, but these can be effective. Some kids do okay just on Culturelle. Others need antibiotics. That's the reality. Comparing Flagyl and vancomycin as a treatment, Flagyl again is going to be more readily available. It's going to be cheaper. It's also going to have cross coverage to parasitic infections too. Vancomycin is a very good antibiotic, very good against Clostridia, but it's going to be more expensive and not as readily paid for via insurance. One thing to consider with respects to Clostridia treatment, neither of these antibiotics, whether it's Flagyl, Alinea, or vancomycin, treat the spores of Clostridia. Clostridia is a spore-forming bacteria. This is where you need things more like high-dose probiotics taken long-term, like Culturelle, or another probiotic like VSL3, or from custom probiotics, the D-lactate-free. These are the things that are going to help suppress Clostridia long-term. Again, this is more of a discussion we have time for tonight. Again, you can visit me if you'd like for more detailed questions on the parent forum through the autismactionplan.com website. A couple other things to consider with respects to aggression. Again, constipation, gut inflammation. This is why so many kids have responded well to something like the specific carbohydrate diet. It's because the SCD diet helps to decrease gut inflammation. The low oxalate diet or an oxalate issue is another consideration, something that you can actually pick up on from the organic acid test as you look at the oxalic acid marker. There's a great website, lowoxalate.info. Oxalates are organic compounds found in many different types of foods, actually healthy foods that many of us eat. But some individuals absorb oxalates to a too high degree. In many individuals, in severe cases, it can lead to kidney stones. Typically what's happening with the kids in the spectrum is we're getting an accumulation of oxalates. They excrete them through the urine. It can cause painful urination, but it creates pain and inflammation throughout the body, which can impact the brain adversely, and we can see aggressive behavior, irritability, etc. from an oxalate issue. VSL3, high-dose probiotic, helps to break down oxalates. Magnesium and calcium citrate, the citrated forms of calcium and magnesium are needed to be taken with meals to help bind those oxalates in the gut and then allow them to be excreted. The lowoxalate.info site is in depth. You get much more information there. If you detect oxalates on your child's organic acid test, or if there's a family history that you know of oxalate kidney stones, that's always a possibility. So the oxalate story is another component, another dietary intervention that can be helpful. Something I think about particularly with kids with just they're irritable all the time, they're constantly on edge. I think about oxalate problems. Also, individuals with fibromyalgia, certainly it has been associated that oxalates can be a problem with them as well. Okay, what about sleep problems? This is one of the first questions that I ask parents is how well is their child sleeping? Because if the child's not sleeping, generally the parents are not sleeping, and everyone is tired and everyone is miserable. So the lack of sleep is really a high priority of things to try to correct. Dietary infractions can be a problem. Again, you have to look and say, is it because of something the child might be eating? Is it because of peptides? Is it because of the gluten, soy, or dairy? Is it because of a food allergy? Is it because of too much sugar? Not eating enough complex carbohydrates and protein, but just eating a bunch of simple sugar, near bedtime. Cakes and cookies and jellos and muffins where they're having a blood sugar problem. Those are some things. So from a dietary standpoint, that might be a link. If that's not a link, you may be looking at some checking a blood level for iron or ferritin would be a good thing to do. Some other things that can contribute to sleeping issues, B vitamins in the evening. B6, for example, can be overstimulating for some kids. I had one child years ago actually had a sensitivity to a zinc supplement that they were taking. A couple other things, too much activity before bed. Many kids these days don't have a bedtime routine. So, it's just expected that they're going to go to bed and fall asleep. Well, kids on the spectrum are very sensitive to electromagnetics. They're very sensitive to frequencies. They're very sensitive to sensory input. So TV, video games, DVDs, electronics will overstimulate their brains and nervous system. And one thing that I found, and I think it's true of all kids, but it's something to be aware of with kids on the spectrum. Even though they may appear that they're not watching TV or not paying attention, they are. They're very aware, and they're also very sensitive and innocent. And I think, because many kids can't talk and they can't express to you how they feel, they can't always express a nightmare. They may not be able to express some type of excitable image that they saw, something disturbing. And, honestly, TV these days, for the most part, is awful with respect to the types of images that are thrown forth into our homes, particularly in front of our kids. And it's a very difficult thing to control. So we have to think of that maybe something that's happening is so creating a routine, turning off the TV, turning off the videos, turning off the DVDs, and creating a routine for bedtime. Some parents, not all, but I found in certain circumstances actually had full spectrum lights in the house. Full spectrum bulbs will suppress melatonin, so we need to turn those off. Also a change in the seasons. In the summertime, you can expect your kids to stay awake longer. There's a natural tendency for kids just to stay up longer during the summer. A couple other things to consider with respect to sleep. Assess the pattern. Do they have a difficult time falling asleep? Are they waking up at night? Are they waking up at night giggling, goofy, self-stimulatory behavior? If they're waking up giddy, goofy, and silly. Think yeast. Could be a phenol sensitivity too, but think yeast. If they wake up irritable and agitated, oftentimes it's a food sensitivity, many times it's a bacterial problem. In those cases, unfortunately, it could be a nightmare, but I wouldn't expect a nightmare to be going on every night. So usually that goofy giddiness and silliness is definitely yeast though. If we have a difficult time falling asleep, many times melatonin can be helpful. Melatonin between 0.5 to 3 milligrams 30 minutes before bed can help kids get to, help. Melatonin can be obtained from many supplement companies like New Beginnings. Sometimes magnesium in the evening can be helpful. Epsom salt baths in the evening can be helpful. I've had a few parents have some luck with some of the herbal teas like chamomile, passion flower, given before bedtime as well. Routine, as I mentioned before, establishing a routine, turning the TV off, taking a bath, getting them in bed, getting them prepared to go to bed as best you can. A couple other things with respects to sleep. 5-HTP and tryptophan. We know that 5-HTP and tryptophan are the precursors to serotonin. Generally, if I'm going to use either one, I will start with 5-HTP. And 1 to 4 capsules 30 to 90 minutes before bed can be helpful for some sleeping issues. Sometimes we have to use tryptophan, although I don't use it that often. As I mentioned before, melatonin is not a bad place to start. The melatonin that you would get from New Beginnings is going to be more of a quick acting. Sometimes we need to use more of a time release melatonin, and where we can use a quick acting melatonin to get to sleep and a time release melatonin to stay asleep. The difficulty is with the time release melatonin, it's a difficult thing to give and use and to have it be effective if your child cannot swallow a tablet or capsule, a tablet or capsule. If the time release has to be broken up and mixed in food, and for the most part it's not a time release tablet anymore. But if you do have a situation where your child can swallow a tablet or capsule, then that time release melatonin is a nice option. Sometimes just a short acting is all you need, and sometimes if kids still wake up in the middle of the night, giving another dose of a short acting helps them to get back to sleep. I've not found melatonin to be toxic. Matter of fact, melatonin is an antioxidant in the brain, so it has a lot of usefulness. Do we want to use it long term? Would it be great not to use it at all? Certainly. Would it be ideal not to use it long term? Well, I think any of these supplements, particularly a hormone, would be ideal not to use long term. So we try to do the best we can to get kids sleeping. But if they're not sleeping and the only thing that works is melatonin, then in my personal opinion, it's a worthwhile thing to use because the lack of sleep is devastating. You can actually obtain time-release and short-acting melatonin through this web link here at Emerson Ecologics. There's a doctor code called Sunset and a zip code of 92591 that actually need to be used to order the time release and the short-acting melatonin. And actually, in doing so, through that link, there's a 10% discount on the supplements through that Emerson Ecologics. So again, this information, by the way, the presentation is being recorded, will be on Great Plains' website for a couple of weeks, but there's also another recording that you can obtain right away through the Autism Seminars on Demand. And if you want to get a copy of the slides, then you can do so through the Autism Seminars on Demand as well and just download the slides. Self-stimulatory behavior, well, there's a lot of things that can lead to that. First, couple things I think of. Any recent illness, cold, flu, or allergies, all known to exacerbate yeast. Is there a dietary infraction? Gluten, casein, soy, other allergens, food dyes, could this be a contributing factor to stimming? Then I start looking at other factors that might contribute to self-stimulatory behavior. Is it worse or an onset after a particular situation? Is it happening at school? Is it happening from something they're doing in the community? Okay, swimming, for example, in the summer, the chlorine may be, in quotes, a potential problem. A gluten infraction that you don't know about. I don't want to throw grandma and grandpa under the bus, but the reality is that some family members don't get it. You know, all kids deserve milk and cookies. You know, that's the perception anyway of some people. So you do some detective work. A couple other things. Is the stemming worse at a particular time of the year? Is it getting worse in the winter, where maybe there's more propensity to illness, or in the spring, where it could be tied to allergies? A new supplement that was added. Maybe it's a lack of supplements, you know, where they need something more. Sometimes you have to work this out, you know, with your doctor to kind of figure things out. The problem is the list for things that can contribute to self-stimulatory behavior are huge. It's not just one thing, unfortunately. And I have found all of these things on this page to be useful for some kids at certain circumstances. Cod liver oil has been a wonderful therapy for visual stimming, side glancing, for example, with some kids. Treating yeast has helped many kids with respect to self-stimulatory behavior. But I've had kids who've had self-stimulatory behavior where cod liver oil did nothing, and treating yeast didn't stop it. But Respen-A helped, or doing a combination of GABA and lithium seemed to make the difference, because in those particular situations the self-stimulatory behavior was also in association with the child being irritable and agitated. So I wish I could give you an exact breakdown of, you know, do these 5 things and it's going to help every time. It's just not the reality. This is why we have so many different things that we can use, and in many cases they work quite well. But sometimes we have to keep searching and searching for other things that are available that may be helpful. And this is why understanding what to do clinically and working with a doctor who understands the subtle nuances of problems is important. So a couple of things from my observation. Self-stimulatory behavior is generally worse with anxiety. It's worse with repeated exposure to the television set, to video games. It's worse with kids being indoors a lot, and I see that happening with a lot of kids on the spectrum. They're in therapy sessions all day long where they don't get outside much. Why is that happening? Is it because of the excessive electromagnetic radiation that they're exposed to? Maybe. It may just be because they're not getting enough exercise. So not getting enough exercise, not getting enough outdoor activity, running, swimming, being in nature, many times will just increase the problem with self-stimulatory behavior. That might be a simplistic viewpoint for some kids. I mean, I get it. There's some kids that are impervious to no matter what you do with respects to trying to help their self-stimulatory behavior. But these are things that I've seen over and over in my practice throughout the years. And then finally, what about regression? Well, the reality is that you have to go through you have to go through that list of all the usual suspects. Is there a dietary infraction? Do you have a history with your child to being a strong reactor to gluten and casein? Could it be yeast and bacteria overgrowth? Even if you did a test 3 months ago that showed nothing, doesn't mean they couldn't have picked up something new, or had an overgrowth occur because of a weakened state of immunity in that moment. Is it a new infection? Is it tied to some type of seasonal change? Again, situational changes that may be occurring at school. A detox reaction. Die-off certainly is something that can cause regression. So is it a new therapy that you've just started? Are you treating yeast? Are you giving something for detox? Are you doing chelation therapy? think back, as to what maybe is going on recently. Could it just be an age transition? Kids develop and kids go through brain development at certain times that can cause emotional changes. I mean, we know that about kids and teenagers. There's a transition point around 10 to 12 years old where kids become combative and they talk back and they're constantly saying no. These same types of changes are happening with kids on the spectrum. So it could be an age transition issue too. So some final comments, okay? I always encourage people to journal. You don't have to write an obscene amount of information on a daily basis, but keeping a journal that you can take you're observing with your child. Keep a spreadsheet of therapies. It could even just be a calendar notebook that you write down in your notebook, in your calendar, when you started a therapy, and then keep some notes under what you're seeing. It's also important to note when you stopped a therapy so that you can share that with your doctor. Try to recognize patterns, okay? Situational, seasonal, time of the day, all of that is useful. And then looking to say, well, what new therapies have been added? What's been seen? Are we seeing any positives, any negatives? No changes? Because a lot of times I'll find that if I find that a child's reacting to something, I'll usually start backtracking on what was just added recently. This is why I often don't like to start 5 or 6 things at the same time. So if I'm going to start a group of supplements, then I'll usually have the parents introduce one new supplement every 24 to 48 hours so that we have a little bit of a lag to see what kind of reaction they're going to have. So the reality is you have to become a detective with respects to your child's particular autism condition. And there's a lot of great resources out there. These webinars I know are helpful for many people. A lot of other great books and conferences to go to, a lot of online sites, a lot of parent chat rooms as well. And then, hopefully, if in time, if it's something that you find useful, this is why I created the autismactionplan.com site, was to be there for parents and caregivers to answer questions, to try ideas, to talk about things that I've seen from my experience. Even if you're working with a doctor, the reality is you can't always get a hold of them. You can't always get an appointment. And this is why I answer questions on the weekends, in the evenings, on holidays. It's an avenue for people to go to who want to have access to a medical professional. Okay, so with that said, I hope this information was helpful for you. And again, this particular presentation can be found through the autismactionplan.com site, as well as the Autism Seminars on Demand website. Again, it has been recorded, will be on Great Plains' website for a couple weeks. I'm also available for private consultations. I have office. I see patients in Southern California, occasionally in North, as having just established some office hours in Oregon, in Bend, Oregon, which is in Central Oregon. So if you're from the Pacific Northwest, you can certainly contact me. If you go to drwoeller.com, that's my central website, you can access my office information through that website if you want to get more information about me, my consultation services. And just an FYI, parents who are members of the autismactionplan.com site actually receive discounts on consultations through my practice, whether that's office phone or Skype. Okay, so just some general information for you. Again, I hope this information was helpful for you. I realize there's a ton of stuff to consider, a ton of different scenarios to consider, but at least you can hopefully walk away tonight with some useful tips that you can start applying to care of your child. And I hope everybody has a great holiday. however you celebrate it, I hope this holiday season is a happy and joyous one for you and your family. And we will be back in, I believe, the second week of January for the start of our 2013 webinar series. Okay? Good night, everybody. Take care.